If you're watching this video series, you probably have back or neck pain and you're considering a spinal injection as a way to treat your pain. Welcome to the Spine Center at Beth Israel Deaconess Medical Center. Your first appointment will be at the Spine Center. If your visit is scheduled in Boston at the main campus, you will come to the Shapiro Building on the East Campus. You will bring with you any records about your back problem, including any MRI, CT scans, or other radiology studies, and your list of current medications.
When you come to the Spine Center, for the first time, you're greeted by one of our staff members at the desk. They have a good knowledge of all of our providers and the scheduling issues that can come up from time to time, and also the services that we provide at our different locations.
You can go ahead and take a seat.
My role is to help out the providers, take care of the patients, and let them know that we're here to help them and it's our job to take care of them.
The first visit at the Spine Center is mostly focused on getting a full history physical of the patient, understanding the problem, and truly listening into the details of the patient's complaints.
There's probably about 20 questions that I ask that would help me determine whether it's a disc disease, whether it's joints in the back, whether it's muscular. Is the pain worse when he coughs or sneezes? Is the pain worse when he sits or stands? Twisting and that kind of thing.
And sometimes they pinch on nerves.
I need to know what the previous treatments have been, when the pain started, how it started, what happened to them if it was an accident, have as much documentation as they can possibly bring.
It's important to get a general sense of the other medical comorbidities or medical history. For example, if you're taking a blood thinner such as Coumadin, then we would need to have permission to have this held if we were going to attempt a procedure. Or if you're a diabetic, we would want to make sure that we have a good understanding of your blood glucose levels or finger sticks before attempting a procedure such as a steroid injection.
Then we'll do a careful physical exam, which will include a careful neurologic exam to make sure, are any nerves being pressed on, is there any weakness or numbness. In some instances, it'll be helpful to get imaging studies, x-rays or perhaps MRIs. In other instances, that won't be necessary, that won't add anything.
After all the options are laid out and all your questions are answered, you and your doctors will decide together the appropriate treatment and plot out next steps. For those who are having an injection, that includes a date and instructions for the procedure.
Once the patient is all set with their visit, they have everything in their hand, appointment time, dates, times, everything, location. So the patient leaves and they don't have to do anything but arrive to their scheduled appointment time.